Hello everyone, here I'm back with a video lecture, and today we are going to discuss the precautions and the contraindications to range of motion exercises. So majorly we are going to talk about something very important, okay? Like when and how to be careful with range of motion exercises. As a physical therapist, we always want to help our patients move and recover. You know that, okay? So movement can actually slow down healing or cause harm sometimes, okay? That's why we need to know when to give the range of motion exercises and when they are safe and beneficial. So that is basically the protocol we have to follow, and when we should have to be avoided or modified that program, okay? So this is majorly the thing that we have to know before starting anything else, okay? So as a physical therapist, you know that passive range of motions therapist basically moves the patient's joints, okay, or patient's limb. Active, basically the patient moves their own joint without any help. So both types of exercise are important, you know that, but not safe in every situation, okay? Sometimes you have to give passive and sometimes you have to give active range of motion depending on the patient's condition. So, if moving the joint disturbs the healing, that means you should have to avoid these, whether that is passive ROM or active ROM. Okay. So, if moving the joint disturbs healing, like fresh fractures, you know that the fractures that are very acute, basically, the severe soft tissue injuries, the time that is right after the surgery, you have to avoid these things. If the joint is unstable or too weak to handle movement, you should have to avoid passive, or whether passive or active, because the joint is already unstable. If you can move any of the joint, it may cause further damage to the joint or muscle tissues or connective tissues, okay? So you have to avoid that. If the patient is too much in pain, whether it shows the signs of inflammation or not, so you have to avoid whether that is passive or active range of motions, whether the signs of inflammation, swelling, redness or heat after the movement, you have to avoid, okay? When the patients tell you that he is feeling too much of pain, or the symptoms shows that he is in too much of pain, so you have to avoid that. So in these cases, forcing movement can do more harm than good, you know that, okay? So you have to avoid these cases. Now, you might be thinking like, if some movement is risky, so should we just keep the patient's joint completely still? It is basically not exactly, okay? You have to keep a joint completely immobilized for too long can cause various of conditions, okay? Whether that is stiffness, contractures, like joints may be so hard that you cannot able to move or you cannot change the patient's condition. So you have to take care of everything simultaneously, okay? You have to take care of the patient joint, but also the immobility as well. Poor blood circulation, and second one was the poor blood circulation. With that, longer the recovery time. So everything is basically disrupts, okay? So you have to take care of everything when time to time, or you should, in a start you just don't have to give the treatment, but after that, after a while, you should have to start the treatment protocol gently, okay? You have to try to introduce gentle movement early, but in a safe and controlled way, okay? So modern research shows that basically the early or controlled movement is often better than the complete rest, okay? Majorly, if you can just start the early or complete, okay, we can just highlight this. This is an important point. As long as patient can tolerate, okay, you have to monitor the patient's condition, and if the patient can tolerate, you can just start earlier control movement in early stages. So studies have found basically the pain-free, gentle passive ROM you can just give this to the patient, whether that is in a healing cases or whether are post injury cases, post surgical cases, everything. Okay, you have to just give the treatment in a very gentle way, okay, in a very pain free range, in a very gentle way. So in the past, therapists avoided the range of motion right after the fractures and surgeries, but now you can just give the patient the treatment. As I have a case that I have a patient who is suffering from the post fracture, but it is so stiff that you cannot able to move the patient's neck. So this is the basically the condition in which the therapist avoided the range of motion, but you are not the one who should have to avoid, because the latest research shows that early treatment takes the um, recovery process faster, okay, the healing process faster, and with that you can also prevent any of the contractures or any of the tightness, any of the disability conditions, okay, the condition that causes so much stiffness or pain. So early movement is very very crucial and very important for the healing processes. So we know that controlled slow movement can actually reduce the pain and speed up the healing. But the key is monitoring the patient, okay? Not pushing beyond their tolerance. You just have to monitor their signs, their symptoms, their pain, their facial expressions, their body, what is their body is telling you, everything. You have to take care of the everything with that, okay? If a patient experiences like the pain increases after movement, swelling gets worse, or the redness or heat around the joint, you should have to avoid the movement. Okay, slow down, modify, or stop the movement until it's safe again. Okay, you just have to avoid starting in too much. So there are some special cases like the patient saw range of motion after the cardiac surgery or heart attack. As you know, in this paragraph, we are going to discuss one here. So majorly, if I can basically take an example of a patient who is recovering from any of the heart condition like heart attack or bypass or angioplasty, they needs an extra care, okay, related to when you have to perform range of motion and what type of range of motion exercises you have to perform after heart surgery or heart attacks. So majorly what was happening here is the small movements or short walks are basically safe treatment protocol. But small movements of the upper limb you have to perform cautiously, because if patient has a median sternotomy done already, so there is chances of some kind of discomfort, tightness, stretch, and patient can feel the pain around these areas. So around the sternotomy area. So majorly, what you have to do is basically the taking the patient for the short walks or the small movements of the upper limb. Okay, like less than the range they already have. Okay, or according to the patient tolerance. After that, the other point is very important, the cardiac monitoring. Okay, the cardiac monitoring is very important because we have to check for the breathing difficulties, we have to check for the blood pressure changes, we have to check for the patient's fatigue condition, any painful condition, any alarming condition. So you have to take care of everything related to that. And other point is, if patient is already too weak, we can start with gentle passive range of motion, uh, probably for the major joints, and active range of motion for ankles and feet, majorly to prevent the blood clots or any of the circulation related conditions. Okay, so majorly DVT condition like DVT, you have to prevent them. So the major goal is to start small and progress slowly, okay, based on how the patient tolerates it majorly. So what was happening is basically in this complete balance of movement and rest, you have to take care of, as a therapist, you have to find the perfect balance. Okay. Our job as a therapist, as a doctor, is to find the perfect balance between the movement and the rest. So movement is good, but only when done at the right time and in the right way. And complete rest is bad, but only when it's too long and leads to stiffness or poor circulation. That means both the condition needs to be in a balanced. Always listen to the patient's body. If the movement helps with recovery, you can encourage it. If it basically hurts the recovery, or you just have to stop the or modify that condition. So thanks for watching. If you have any query, you can ask. And this is all for today. Thank you. Bye bye.